So good afternoon, everyone. This is Audrey Russo and President and CEO of the Pittsburgh Technology Council. Very excited, as I am every day, on the people who we get a chance to talk to. And today is no exception. In a moment, I will introduce our guest, who's the Chief Information Officer for Net Health. It'll be very cool to talk about Net Health and all the changes that they've actually gone through and the growth over the years. So I want to give a shout out to Huntington Bank. I want to thank them for believing in us and the work that they do across the entire community, both as a lender and the array of services that they provide. They have been a leading partner of ours and have just taken a chance on a lot of the experiments that we've run. And I guess in a year of doing BAUs, business as usual, it's probably not an experiment at this point, but they've been with us at every leg of the journey. 40 by 80, that's the wholly owned subsidiary of the Pittsburgh Tech Council. And it is our charitable organization. It's for the longitude and latitude of Pittsburgh. And our focus is on entrepreneurship as well as workforce development. And soon you're going to hear more about apprenticeships. So a couple of things. We've put your mics on mute and you're going to have a chance to chat with our guest and ask some questions, but this isn't a time to sell your wares. This is a time to just focus on our guest. And I'm now thrilled to introduce Jason James. I also have Jonathan Kirsting here. He is the Vice President of all things marketing, and he will keep his eye on the chat, and he is our master storyteller. So I'm bringing to the forefront now Jason James, who has told me that he goes by JJ. So appreciate that. In case you think I'm doing that without his permission, I have his permission to call him JJ. So thank you, JJ, and thank you for joining us. You're joining us from Atlanta. He splits his time in Pittsburgh, but he essentially is part of the executive leadership team at Net Health, and they've been virtual for quite a while. So JJ, how are you? First of all, how are you?
I'm good. I mean, as good as we can be. I mean, we've been living in a year of not really working from home, but living at work.
That's a good way. So you get no break, right? Is that what's happening?
Well, yeah, at any moment you could hear my 2-year-old start banging on my door. You know, I've got very noisy coworkers. So between my 2-year-old and my 3-month-old, you may hear some noise in the background.
Right. So is there anyone in HR that you have a direct pipeline to?
It does. My wife is former HR. I have been filing complaints for like a year now, and I don't know where they're going.
Okay. It sounds like you're not successful, but it sounds like you're a good parent. So I think it's great that you're home, and it's okay if we get interrupted, just so you know, it's okay. So JJ, talk about yourself. What's been your journey? How did you land in the role that you've been in? Just sort of, rapid fire. Tell us.
Sure. So let me give you a quick background. So every job I've ever had has been in IT. So I live in Atlanta. I grew up about 2 hours southeast of here in a very small town called Opelika, Alabama, known for textile mills. And so when I was 15 and everybody was working in grocery stores or working in the mill, I was laying out Lantastic networks and doing PC upgrades. Did that for a few years, bought a company I was working for when I was in college, eventually moved to Atlanta, did the startup scene, had a couple of exits. Most of my last few jobs have been because of my network. You know, your network becomes part of your net worth. And so through my network, I landed a role at Optima Healthcare in Atlanta. It was headquartered in Florida as CIO. And then we were acquired by Net Health out of Pittsburgh. And the board and the CEO and the executives had the wherewithal to ask me if I would stay on. And so I love it. I love Pittsburgh. It's a great city. In fact, pre-pandemic, I was looking at buying a place. And then the world changed roughly a year ago. But it's a great organization. You know, what we've been focused on is not only reuniting caregivers with our calling, but, you know, in a way, building a culture we're extremely proud of.
Well, so that's really cool. Wait, you have a how-month-old baby?
I have, she just turned 3 months. And so I came back from paid parental leave at the beginning of the year. So I took off almost 2 months. Net Health believes in paid parental leave. I'm a big proponent in men taking a larger role in the upbringing of their children. And so I wanted to make an example of it. And if, you know, it proves my succession planning worked, but it also proved that men can do it. What I wanted to break was the stigma of men taking parental leave. You know, if you go back to my late father, he wasn't in the delivery room when I was born. His generation didn't do that. But now, if a father didn't do that, they would be almost ostracized. And so, what I wanted to do was to sort of break that stigma. Men should be at home helping their partner as much as possible. And by the way, executives can do it. So, I've been pushing more and more CIOs to be cultural leaders and walk in their CEO's office and saying, hey, it's time we pay parental leave.
That's great. That's great. Wait, so did you have a COVID baby?
Yeah. And it was one of those things that became, we found out right when COVID hit, and it really changed healthcare, obviously, but it changed healthcare for those actually having children, because I couldn't be in the room with my wife when she had the ultrasounds. Luckily, I had done that with my first daughter, but it really changed that. And when she was born, I could be in the room, but you know, with COVID everything going on, we had a neighbor watch my 2-year-old. So I stayed with my wife and my newborn for a day, and then I had to leave the hospital. I wasn't allowed back in until it's time to pick them up. So you know, you have to adapt, and so it's one of those things. It was several months before even our parents saw our new daughter.
Wow, great story, and great. And that's sort of in alignment with what we know about Net Health in terms of their culture and how they've embraced, you know, just even those in Pittsburgh in terms of their commitment to a supportive and innovative culture. So that's great. So let's talk about Net Health. For people who aren't, you know, don't know anything about Net Health, or just reset the table so we can understand what is Net Health.
Sure. We're a SaaS provider that focuses on the entire continuum of care. That's everything from hospital to home. So we have solutions in skilled nursing facilities, wound care, hospice, home health. So we cover all those aspects. And so in doing so, we're in every bit of healthcare. And again, that goes from the hospital to how people get care in their home. And so it's, you know, and that's changed a lot during COVID. You know, if you think about, you know, how people could get care, you know, it didn't stop, right? How they got care, how a patient could be treated may have changed, but people still had wounds, right, that had to be taken care of. People were still in skilled nursing facilities and nursing homes that still had to be cared for. In a way, we may not have been frontline workers, but we were empowering those frontline workers to do their job. And it was something we're extremely proud to do.
And so what about some observations during COVID? Are there, I mean, with you essentially having a front row seat to the issues that, you know, people are grappling with even now?
It's so stressful for healthcare workers. I mean, so if you think about it, their job was in high demand, high stress to begin with, but now they're facing a real threat. And going in, that could be a risk to their life. Many organizations didn't have adequate PPE when it first began, but yet they were still caring for patients that were obviously contagious. It is a pandemic, and trying to not only, you know, take care of patients that were getting very sick and dying, and then at the same time trying to balance a home life, right? And, you know, their kids being sent home and trying to balance with how do you homeschool a child or young children when at the same time you're still afraid of, am I going to pick this up and bring it back home? And so what we found is that healthcare is under a tremendous amount of stress. It was already a strained industry to begin with, but you couple that with pandemic, and then it took a toll on a lot of organizations and a lot of people that serve those organizations.
Well, talk a little bit about the culture. You mentioned just a little bit about, you know, obviously personally, and the leave that you had a chance to take. Well, talk about the culture. I mean,
sure. So
obviously you're seeing so many things up front.
Right. Now, when you say, you mean our culture or the culture facing healthcare?
Your culture and how you address that, because you're the support behind the support.
So obviously what we had to do was, as people are serving these industries, we had to serve our own people. And so we created these virtual water coolers. If you'd have been in a traditional office, you will bond over connections that have nothing to do with work, right? So it might be barbecue, or it might be your pet, or it might be your kids. We wanted to simulate that kind of environment. What we realized was when people weren't in an office, they still needed to connect. And so we created these virtual channels that allowed people to connect. And so we also had events during the day, that made sure people understood that, hey, productivity is extremely high. How do we get people engaged? How do we make sure they're engaged? How do we give them a break? And so we had people, we were lucky. We had somebody on staff that was a certified bourbon steward. And so she taught a class on bourbon, and then I taught a class on barbecue. And so the idea is, how do we get people to connect if they were in an office over a shared mutual passion that has nothing to do with work? And that's one thing. What it ultimately led to was more and more discussions. And so we didn't shy away from those discussions. Some of those discussions that arose were what happens when, people wanted to talk about the George Floyd incident and Black Lives Matter. And we didn't shy away from that. In fact, I was lucky enough to moderate a panel, a fireside chat between our members of color, and people were allowed to bring in their families and employees and really discuss, what does that mean? What does it mean to be a person of color in America today? And so what we find is, as we evolve, we're creating a much larger table to make sure people are represented within the organization.
The role of health IT and the role of this work, the timeliness of it and the importance of it, obviously can't be understated. But we talk to people in government, we talk to our colleagues that are in healthcare. It's become so obvious, that the medical billing and compliance software, the shortcomings have all played such a substantial role in the dispersal of, even vaccines, right? So has NetHealth created a COVID-related solution or software to help your clients during the pandemic?
Sure. So part of our agility platform allows healthcare individuals to schedule vaccine distribution, right? That's important. How are you getting people, and ours are focused internally, meaning within those organizations, not necessarily for the public, but for those organizations. Like if you are running a very large hospital chain, how do you make sure you're coordinating your staff with the ability to get a vaccine so they can feel more protected as they face a growing number of infections in America?
Well, Pittsburgh, we're going to brag on Pittsburgh for a little bit. And since
you should, it's a great city.
Yes, it is a great city. And we're really fast becoming sort of the epicenter of both AI and health IT. And, obviously NetHealth has a big piece of that. From your perspective, what does the future of AI look like in terms of capacity, in terms of solving healthcare challenges?
You have to look what's going on in the industry. And I'm going to go so far as to leave Pittsburgh and end up in Japan and look at what's happening at Showa University and the way they're able to use AI to do early detection of colorectal cancer. You're talking almost 5 years ahead of what you would find within a traditional physician setting. And the reason of that is it's AI's greatest strength is pattern recognition. By the way, the same thing humans are great at, right? One of the things we excel at is pattern recognition. Well, AI takes human pattern recognition and really amplifies that. And so when you talk about predictive care, right, it's being able to pick up minutia that may be changing prior to even a physician seeing it. And so what they're doing there is, again, being able to pick up early signs of cancer long before a traditional physician would see it. What we're seeing in the United States and what we're going to see in healthcare IT is that more and more will be brought to bear. If you look at what we're doing in terms of wound care, the ability, NetHealth takes the ability to be able to measure a wound, to look at a wound, find depth, find color changes, do predictive analytics in order to know what is the care of the patient, how that will change, how that will impact them. If we fast forward about a decade, what we're going to find in the more progressive healthcare centers is that AI is going to be as commonplace as a stethoscope was for the last 150 years, right? And we need it because the complexity of diseases, the complexity of of how we treat the options we have to treat patients evolve. And so if we look at AI, it's our best resource in order to be able to correlate all that data to provide a better patient outcome.
So now let's look at your role, Chief Information Officer, and those roles have changed over time.
Oh, yeah.
And it depends upon the organization, and it seems like you're in an executive level role. So talk about your role, talk about the importance, talk about the things that are your priorities right now, and maybe how it's changed over time.
Right. So if you look at a CIO, all great CIOs have evolved into transformational CIOs, the ability to look at the technology, look at the business, and grow that. And that's been really, for the last 2 or 3 years, our focus, right? Transformational CIO. I believe pandemic has created the cultural change agent in the CIO. If you look at what we've been able to do, if you've been able to work for the last year, you need to go thank your CIO. You need to go thank your IT team, right? If we go back a decade, 20 years ago, what would the economic impact have been? But what we find as people work more and more remotely, there is a need to connect with them in a much deeper sense. And some of that's not being driven by HR. It's not being driven by the operations. It's being driven by the CIO. And it's not only having tools in place, but looking at tools and looking at how people work and removing friction, looking at tools that allow them better connectivity, not only with the business, but with each other, right? It's my hope there's this humanization of IT, right? That we look at IT and realize at the end of that packet is our most important asset, and that's people, right? And so that means we have to look at technology that's a lot easier to use. We're on a platform. I'm sitting in Atlanta, you're sitting in Pittsburgh. The reason we're able to do this is because Zoom has created this amazingly frictionless audiovisual aid. How often have we walked into a conference room, and even me with my 3 degrees and go, why the hell is this so complicated? Why can't I get connected to this, right? I think when we eventually return into an office, those that do, I think we're going to start demanding more frictionless technologies. How often do you lean over while you're working and ask Alexa, which she might go off in a minute, to play your yacht rock, right? Or for me, maybe something a little more Jimmy Buffett. And so somebody asked a question earlier, what are those colorful things? Those are geeky tiki. So aside from barbecue, I'm a big tiki enthusiast. But the idea is all this technology sort of incorporates into itself, right? We have to look at tools and how humans are using it, especially at the healthcare level, right? How often have you gone into a healthcare center and they make you fill out a form? And, I had a healthcare provider about 18 months ago. She said, well, can I fax you some information? I said, well, I don't get faxes where I live. And she goes, well, where do you live? I said, the 21st century. I said, you can either send it through an app or email me, but I don't take a fax. So again, I think this role as the cultural change agent coming from the office of CIO is going to expand. Again, it starts with looking at frictionless technology, but it also comes with realizing we're trying to empower people to do their best, right?
Well, let's talk about the workforce, like the office going back to work, right? With the pandemic, with numbers hopefully declining, the increase of vaccines, et cetera. What do you think the future of the office is?
Yeah, I believe, well, first of all, let's be very transparent. Pre-pandemic, we had about a dozen offices in the United States, with Pittsburgh being our headquarters. Pittsburgh will continue to be our headquarters. We have shed almost a dozen offices. Myself, I've given up a permanent corner office for a permanent home office. Now, that doesn't mean I won't travel more and more, but the idea is the office for a lot of organizations will be less relevant. I think there'll be millions of Americans that never return to an office Monday through Friday, 9 to 5. The traditional office hours are over. A traditional office for a lot of people are over. That doesn't mean people won't go in. That doesn't mean they won't go in from time to time. But let me tell you, for all the leaders out there, if you think everybody wants to be in your office Monday through Friday, 9 to 5, those days are done. And I see it all the time. I sit on a lot of national CIO advisory boards, and it's definitely demographic driven. The CIOs I see that are over 50, they're like, we need to go in now. And those that are under 50 are like, I think there's going to be a flexibility. I think people at times are going to want to go in, but at times other people won't. How you connect with people will matter more so than four walls. Now, the offices that are left have to be, like I talked about, a lot more frictionless, right? Can you easily collaborate? You got to give people a reason to go in. I'm sitting in my home office looking at 4 screens right now, right? I'm highly productive. That doesn't mean I don't want to see people. That doesn't mean I don't want to connect with people, but there'll be a large portion of people that they'll opt that's not their way of life. And for those that think it can be, and all your people have to be in there every day, well, let me tell you, I'll come after your talent all day long because I don't really care where they live. I only care about the work they do.
Mm-hmm. There's a quick question from Eric King, Jonathan, if you just want to grab that, and then I want to.
He's got 2 here, and they're really good ones. Great to see you, JJ. Thanks for being part of the show today. So Eric King wants to know, where is your AI capability being developed and implemented? Is it externally contracted, or do you have competency located in-house?
Great question. We have competency in-house. We have data scientists. We've expanded data scientists. We've acquired companies in other areas. We acquired a company called Tissue Analytics, which is now part of our platform. They were out of Baltimore. AI, we talked about it earlier, Audrey talked about it. Pittsburgh is an epicenter. You look at what's happening at Carnegie Mellon, Pittsburgh will continue to grow and continue to be vital. So certain areas you look at that are, defined by what they do. If you look at cloud, Seattle's a big player. If you look at fintech, Atlanta's a big player. If you look at AI, Pittsburgh is the player. And so more and more organizations are going to grow out of that. If they don't have a presence in Pittsburgh, they'll still have probably talent in Pittsburgh, right? And Carnegie Mellon and the surrounding, universities have been driving that. And so lucky for us, we have it in-house. But when we say in-house, they might be throughout America, not necessarily located in one geography.
Very cool. And he has a kind of a follow-up to your comments about humanizing IT, which I think is really important to talk about. He wants to know, do you have any soft skills staff to work on the critical social sides of AI and analytics?
So obviously that's where it becomes important. And so not to pick on data scientists, right? Let's pick on all of IT, all technical people. A lot of them got into technology because they weren't all that great with people. That's not true anymore, right? It may have early, there were plenty of Linux admins I worked with back in the day that lived in the basement and played D&D all the time. No shame in that, right? But what we're finding is there's a lot more people getting out of that mode and understanding. In order to understand data, you have to understand people. If you look at what a lot of organizations are hiring, right? They're hiring anthropologists. I'm fortunate. My master's is in IT, but my undergrad is in anthropology. It's the study of people and culture and how they use tools. What we're going to have to do with our data scientists, unfortunately, is get them with people, right? They have to understand what they're doing. And in a healthcare setting, you have to understand the patient, right? All of us have had an experience with a doctor where their bedside manner was awful, right? What did that mean? That means you weren't as comfortable with your doctor as possible. That means you weren't comfortable communicating with them. Well, guess what, data scientists? Guess what, IT people? Your client is people, and you're going to have to connect with them. What we will find, though, is that there'll be these intermediaries. There'll be people that just touch data, right? And there might be people that act almost as a data psychologist that goes in between teams and help them understand people better. But again, when we talk about this humanization of IT, at the end of the day, we're still serving people, and we have to have a better understanding. I think when you look at the pandemic, one of the greatest things that happened with it, it was the largest push for digital transformation in the world, and in some ways a cultural transformation. So I do think we're going to see more soft skills. The biggest soft skill I tell leaders they need right now is flexibility. Mm-hmm. Stuff happens, right? At any point, my 2-year-old could bounce in the door and start throwing stuff off my desk. That's what happens, right? But we also have to understand that, we have to communicate. We have to find how we communicate. The other, not that this where this question lies, but one of the other positive aspects I see about this remote workforce and this working from home is it's given a level playing field to those with disabilities. If you were in a wheelchair, if you had some form of challenge where it made it hard to get in and out of the house, that's talent you can go after right now, right? If you have the kind of progressive organization where you don't require people to come in, start looking at diversity initiatives so you can bring in that kind of talent. Because when we have a more representative workforce, it gets us closer to that humanization of IT and also gets us closer to understanding each other.
So are you hiring?
Yeah, there's plenty of job postings. You know, we continue to hire, go to our website. The vast majority of the roles that we fill are throughout the United States. We still have a large presence in Pittsburgh. We love people in Pittsburgh, but if there are people listening from outside of Pittsburgh, don't let that stop you.
That's great. So now I want to, as we wrap up, I want to talk about something that we talked about earlier. Spring is right around the corner, right? In less than 3 weeks. And I know it's warmer in Atlanta where you are, so you've probably been doing this longer than we have. People are going to be pulling off our grill covers and getting our grills ready for summer. And my good friend, Patrick Coletti, hopefully he's on the call somewhere.
He is on the call. I see him.
You see him? Okay.
I do see him. He was one of the founders of NetHealth, claims that you are a world-class, and I'm going to say this because I can't say it any other way, barbecue expert, BBQ expert. I am actually a Kansas City certified barbecue judge. I've judged in 8 states in the District of Columbia. I do have a hobby that I judge barbecue. I'm what's called an egghead. I'm a big proponent of the big green egg, which is not only grill and smoker, it's versatile. But yeah, that's one of the hobbies because it's really the opposite of IT, right? You know, everything we do is about speed. That will ruin barbecue, right? This idea of it's in a way, it's one of the original American inventions. Obviously, so many cultures grill and cook meat slow, but American barbecue is very different, right? You know, born out of the slave movement, it has roots much like jazz and rock and roll. You know, born in the Deep South and born in other parts of the country, but it is an American institution. You got to have hobbies other than what you do. And so it sort of level sets and reminds me that I can't rush things, you know, and so it's fun.
So can you give us some helpful hints? Because I think I might want to have you back on the show where we only talk about BBQ.
That'd be so much fun. And then eat some.
I think, maybe we could, watch you do that and give us some advice. So what's your favorite?
Oh man, it's I'm a big growing up in Alabama and living in Georgia and traveling throughout America, I'm still a big fan of Texas barbecue. If brisket is done well, it is one of the most fantastic cuts of meat out there. But it's hard to do. It's one of those things that people constantly master and try to master, and really it needs 2 things. It needs salt and pepper. The rest of it is just time,
How long?
Well, it always depends on the weight, right? But, anything I'm doing in terms of brisket is generally about 12 to 14 hours.
12 to 14 hours? Okay.
Hours, yeah.
In a smoker?
Yeah.
In a smoker. Yeah. And then what about, do you cook any fish?
Occasionally I'll do a smoked fish dip. So when I was traveling more to South Florida, they will do what's called a smoked fish dip, and they would smoke fish and then blend it with, sour cream and cream cheese and mayo, and it makes a really great dip kind of thing. But yeah. Okay,
well, here it's lunchtime. So I think, you've whet our palates. It's been thrilling to have you on.
Thanks for having me.
I love to hear the NetHealth culture continue to proliferate. And I love your reminder that it takes both parents to participate. And I'm glad to hear about your candor on addressing a lot of tough issues. So I think that bodes well for anyone who's interested in NetHealth. Really appreciate the time that you've spent with us. Is there one other thing that Eric is trying to get in here? Speaking of net health culture, are other C-suite execs at Net Health reasonably AI and analytically literate?
Absolutely. You know, we believe that as we evolve the organization, what we're actually evolving into is a predictive analytics organization serving healthcare. In order to do that, AI and analytics itself will be a strong pillar of what we do.
Well, JJ, you've been awesome. I can't thank you enough for being so candid with us. And so what do you think? Maybe we check back in and we do a BBQ 30 minutes?
I think once we're willing to travel, I think we could do it live as well, right?
Ooh, you hear that? I'm loving that. I'm loving that. That sounds like a plan. Well, I want to thank you for joining us, Jason James, also known as JJ, the Chief Information Officer at Net Health. From Atlanta. Really appreciate it. Stay safe, enjoy your kids. We will be in touch with you. And tomorrow, same time, what do we have going on, Jonathan?
So we're continuing our conversation on all things artificial intelligence. We are welcoming Colonel David Bradshaw, who's the Deputy Director of the Artificial Intelligence Task Force with the Army. It should be a really fun conversation.
It is. It is. Thanks, JJ. Thanks, everyone. Stay safe.
Take care, everyone. Thank you. Bye-bye.